Yeah, hi everyone. My name is Ravi. I'm the co-founder CEO of Zeeve, and welcome everyone to today's AMA. This is a conversation I have been personally looking forward because it sits at a very intersection of three very core problems: healthcare, data ownership, and interoperability. And I believe that healthcare is one of the last major sectors still running on highly fragmented institution-centric data models. We have worked with few other startups who are doing something in the healthcare space. And as you know, finance, insurance went through decentralization over the last few years with stable coins, tokenization, and so on and so forth. Healthcare, I believe, is just beginning that journey now. So today we have Abhimanyu, and who is the director of AI and operations at Ulalo. Ulalo is building something quite bold, a sovereign blockchain-first healthcare platform where patients actually own and control their medical data. So I think it's a very interesting venture, and I believe it will be very interesting to talk about what Ulalo is and how it is going to revolutionize the healthcare sector. So Abhimanyu, great to have you with us. And let's start with a bit about yourself, how you started your journey, and how your Web3 journey has been so far.
Thank you so much, Dr. Ravi. Thank you so much for a lovely introduction about Ulalo. Yes, just to give more brief about myself. So my name is Abhimanyu Dayal. I work as a director of AI and operations at Ulalo. My journey in Web3 started back in 2013 when I started working for a Bitcoin ATM company in US, where we became a liquidity provider. And then that sort of journey translated more towards the web development application, led to AI, where I was dealing with a lot of facial recognition systems as well in early 2020s. And then post that, it kind of matured into this Ulalo, where we started looking at healthcare data, and then these AI systems and these chat GPTs and LLMs became available. So the natural progress for us was to look into the intersection or a union where the patient data can be coupled with the idea of LLMs and can be translated. But one of the main problems that we recognized early on was around the data privacies and the issues related to that. So we started exploring an idea to build a bulletproof system which allows users to have a privacy and control over the data, and then mature it as a tool for them where they can use that private data, uh, anonymize it, because we wanted to protect patients' identity and turn it into a monetization source of a partial income from them for the data. So that's what we tried building in Ulalu, and that has been our journey so far. We've been working with Z for quite some time, and all I can say, our experience with them have been absolutely amazing so far.
That's quite a journey, Abhimanyu, and I think it seems that you have built the required expertise and experience to build something like Ulalo. So, if we talk about the core problem that Ulalo is solving, like so today, as we know that most healthcare systems are optimized for institutions and not patients, and then we on the consumer side understand it very well. Still, we are very bound to paperwork. Even if there are digital records, they are siloed, they are logged, and they are highly inaccessible, especially when patients need them the most, during emergencies or travel or second opinion. So I think patients deserve ownership of their data so that the data can, one, as you rightly said, managing the privacy and security, and they would be able to secure that data, but at the same time, they would be able to use that data for various use cases. So, what's the biggest gap that you see, which compelled you to launch Ulalo, and which Ulalo is solving big time?
Absolutely, Dr. Ravi. So one of the biggest problems that we saw was data as being unavailable for the patient themselves. These data are kept in hospitals and different health organizations, and you have no idea what is going on with the data. Neither you can do anything. With the advent of AI and everything, all the treatments, everything is going to be data dependent. So you having no access to your data is kind of a exclusionary process for you. You don't really know what is going on with your health. And the biggest problem becomes when you're traveling from one place to another. Even if you're going from one hospital or healthcare provider to another, there's a lot of data which is lost. So we named the company Ulalo, which means building bridges in Swahili. So we are creating these connectors. We are creating these platforms where you are always in control of the data. It is encrypted under private key using the same uh, encryption technology which was used in a Bitcoin encryption as well. So we are using public key and private key cryptography, where you encrypt the data and you keep the data with you. And when you go to any other hospital or any other data provider, you make your data available to them. So you, first of all, know what is going on with you. You have that data available, and then you are able to transport that data from one place to another. So yeah, and that's was one of the biggest problems that we were trying to solve. While solving this problem, another major problem that we realized was what is happening to the data when it is kept in the hospital. Okay, so when it is kept in the hospital, these data are the new oil, and it's worth quite a lot of money. So hospitals collect this data and then they sell it to the research organizations and everything, and they make money. But we believe that data is your private right. It is your right, and it is connected to you. So we are creating a system where you would be able to directly take your data and sell it to the companies while protecting your privacy and everything, and get paid for it. So if you want to participate for a trials, or if you want to submit your data for a medical research, you can do it, and you can basically earn money from that.
Got it. No, I think that's a very interesting point, Abhimanyu, you have mentioned. Like, there has always been a debate about data monetization and real data ownership. Now, if we talk about social platforms, I think the narrative is still divided, because it's a user-generated content, but since users are using a free platform, the platform does need to make money somewhere or the other. But when we talk about hospitals, I don't believe there is any reason, because patients are already paying to the hospital for any services they get. So it doesn't make any sense for hospitals to actually own the patient data and monetize it for their own use. It is, I think, legally, I don't think it is allowed. But as you rightly said, it is being used for multiple purposes, whether research or any other purposes, which it should not be. So just a follow-up on this, do you think centralized systems can fix this, or is decentralized something at the core of this?
100%. So we are building a decentralized system, first of all. So you always remain in control of the data. Nobody can see or access your data without your permission. The centralized data are very interesting, and they were believed to be this giant systems that can add a lot of efficiency in the system. But the problem is, like, they become a central point of failure as well. And the stakes are very high to attack the central system from a cryptography point of view as well, to attack the central system and increase and steal the data. And that's why you're seeing all of these data systems in, like, insurance company and hospitals are regularly attacked, and the data is stolen, and your data is available everywhere on the internet without you ever knowing it, till you understand, like, what is going on. So I was looking at a back end of this insurance pricing company, and what they were doing is, like, when you would apply for insurance, they would go through all your social media. And that's back in 2015 and 16, when the privacy laws in social media were, like, kind of little bit up and down, right? What would they do? They would look at your social media, and if you were wearing glasses in any of your images across the internet, your insurance premium would automatically go up. And that was so scary for me. Like, you have no idea where your centralized systems are selling your data without your permission. And that became one of my personal interests. This whole situation was always in our back end. And that made me very excited to join Olalu and to build this decentralized system where you are 24/7 in control of your data, like an NFT, which is sold on, like, back in the days, an OpenSea platform and everything. So so no matter how many hands it would change, there would be a fee which would be going in your hand, and you know exactly who has your NFT. So bringing that with the privacy of a blockchain technology and a decentralization without a single point of failure, that's what inspired us to build this platform.
Got it. Got it. So, as a further follow up on this, now when somebody wants to use decentralization at the core of their venture, then there's always option to run your app on a public chain, right? In a shared block space, in a shared environment. Typically, when we see DeFi apps or financial apps or healthcare apps, they tend to launch their own sovereign L1s or an L2. So, I think a lot of founders, they always struggle with this question: why not just deploy on an existing chain, a public chain? So, in the case of Ulalo, what was your motivation to launch a sovereign L1 instead of using a shared public chain?
Absolutely, absolutely. Because we wanted to build the monetization layer in on top of our own system with a high throughput and for a ease of benefit while remaining everything like completely transparent, also lowering our little bit on our infrastructure cost. That's why after a lot of R&D we decided to launch the whole thing on our own L1, because we thought that the monetization and the data anonymity that we want to build in and the kind of performance we want to build out of the system would be much better if we have our own public L1 compared to launching in on top of as an L2 or something. More importantly, our CEO is also an extremely technical person. He has been building these systems in Europe for quite a long time. So we all discussed and we thought that it would be the best that we launch ourselves on L1.
Got it. I think you have mentioned some great points. Having your own sovereign L1 means you control the block space. There's no challenges of congestion or token prices. You control the data. You can manage the compliances. So, just one question. So, did regulatory and jurisdictional flexibility also was something which influenced the decision, or it was mostly on the performance and data ownership side?
It was mainly on the performance, but the compliance became a silver lining. Now the managing compliance on your own L1 is such a breeze compared to being on a public chain. So I think that was, uh, we didn't think about it at that time, but somehow it became a boon for us at the moment. Like we are kind of slim on the compliance side because we never have any access on people's data, and we are completely compliant with GDPR as well as your HIPAA regulations, because we have access to no patient data. The patients are always in control of data. So yeah, and while having our L1, the compliance became a much more breeze.
That sounds great. So now, doing a deep dive into the Ulalo ecosystem. So one, I think Ulalo, as you rightly said, has a smart wallet for each patient. And this Ulalo wallet scans reports, they extracts data, it stores the proofs on chain. And it also enables sharing of the data, in fact, globally. So can you give us a brief about the AI and the wallet component of your ecosystem? How does it benefit? How does it differentiates? And what kind of value proposition patients have or users have?
Absolutely, absolutely. So what we have is we have an inbuilt library, first of all, where every time you upload a document, we remove PPI, your personal identification information. Then this data is like safely fed inside an LLM, where a simple language translation of your complicated MRI or CT scan or your prescription letter is generated that you can have access to and you can always read about it. And it sort of creates your health timeline. So you know, like, oh, in few lines, you know what is going on with you, what is high, what is low, and you have a deep understanding of what went wrong in your, for example, say blood work or MRI. So that's a summary creation we do. Then we take your data and we kind of we generate it as a hash, we put it on a blockchain. That data is very safely secured, and then we share that hash ID with you, so you know exactly where your data is stored. And every time you want to share that data, you can just share it with. We would have the sharing features coming in. Right now, we have the storing option, which is available. It would just be like scanning a QR code. You would be able to scan a QR code of a doctor and share the data with them, and they would be able to see your entire health. So there are some diseases which takes time to mature, like say 10-year period or something, and their diagnosis towards the end becomes extremely difficult towards the end of the life cycle, when the disease is full blown, like you don't understand what is the origin of it. If you're able to understand the origin of it, you can cure it. Now, when you have the secure data and you can see all your entire information over the last 10 years, that becomes very interesting. But it doesn't become just interesting at the point of the data. What we are also building is we are building hospital dashboards as well. So your data would flow from your system, scanned via QR code, to a doctor system, where you would have a set of multi-agentic systems who would start analyzing the data, analyzing the deep patterns, and would show that deep patterns on the doctor's screen, where they would have a much better insights over you. Now, this would not be that, I mean, it would be interesting for places like with really good clinicians and very important, very specialized physicians as well. But this becomes a very important features for a third world country, where you don't have that many specialists readily available in every single village or town. So, in every single village and town, you can have doctors, basic doctors, who would have this array of AI agents, who would turn them into a specialist performing diagnostics on par with the super specialty hospitals. And that's what is a complete vision of Ulalo at the moment.
Got it. No, I think this is super interesting. So it means that your approach is that AI is not bolted as a feature; it is embedded into the user journey. And as you rightly said, it can be used where the doctor-patient ratio is very, very poor. A lot of developing countries are facing with this challenge, and I think AI can play immense role to solve that. So just a side question, multilingual healthcare data is still a nightmare. So how close are we to solving that?
Yeah, we are actually solving it step by step. Like, we are building our entire CMS system, which would translate data from one language to another, and we would have 4 different languages available from the next week. It would be French, Spanish, Indonesian, and English. So it would do inter-translation between these languages. We would be going further, and like, we want to have all the languages. So slowly, like every month, we would add 1 or 2 different languages. We would test it out truly and would make that available into the application. So the summary part, where you get the data summary, you would be able to see that summary in your local language. You would be able to translate your prescriptions into different languages, and you would be able to share it or turn it into a PDF, which can be shared with your doctor.
Got it. And does this require digital prescriptions? Because reports are pretty much digital today, but prescriptions are still most of the times handwritten. So because OCR, as I believe in healthcare, is very messy. So how do you approach the accuracy part of some of these prescriptions?
Absolutely. It's very tricky. We have the OCR available. We are using one of the best OCR. We are right now, we are using Gemini system, because we are still in beta. But once we come out of beta, we want to use DeepSeek OCR, which is one of the best OCR system in the market. But that is definitely going to be a concern, and it is going to be a problem. But what we are doing is we are piggybacking on top of these LLMs, and these different products are coming up. So I believe, like, the future of these are absolutely great. So once these OCR is better, we would make them available. Right now, we have some safety checks in a form, like if you upload a handwritten prescription, it shows you the information that is abstracted. And if you see the data which is hallucinated or something, you can ask it to re-upload to see if the if the hallucination goes away. But I would just say, yeah, it is definitely a problem. Like reading different handwriting, it's definitely a problem at the moment. But I am really big on LLM, so I think they should solve it in the future.
Got it. Oh, that's awesome. So Abhimanyu, Ulalo has taken the journey from testnet to mainnet. So what are the major features which are live today? What milestones are there, and from a readiness standpoint, how production ready it is so that users can start using it?
Well, users can use it right now. Like you can upload your data. You can have a data summary extracted from AI and everything. Your data would be secured in Ulalo. It would always be there. It's a decentralized system. So we are sharing your hash IDs and everything, hash IDs of your document and everything. So that is all there. Some of the things or the features which are coming in the future are like we would be having a cloud LLM infrastructure, which is like little expensive for a small company. So that is the cost as being a major factor for us. But we would have this cloud LLM systems where we would be deploying the LLMs locally on our infrastructure and giving access to an API. That would be there. Second, we would have data monetization that would be available. So not only you would be able to collect the data, you would be able to sell your data to a research after with privacy features built in, of course, and complete control over the data. Third thing is going to be the doctor dashboard, which would be available, which would be sort of game changer because you would have like a data going through a large AI model. Imagine it as a cursor for healthcare, where your data is going to be completely analyzed and presented in front of a physician who would have a better understanding of your disease. So these are the three critical features which would be coming in the future. But the basics, putting your data, summarizing the data, and even the language and the translation would be available from next week.
Great. That sounds absolutely great. So Abhimanyu, a bit about Zeeve and Ulalo partnership. So we understand that healthcare infrastructure has zero tolerance for downtime, and some of the points that you mentioned, having a dedicated block space with high performance, 24/7 monitoring, automated recovery, and deterministic performance. So how did Zeeve influence Ulalo's reliability and scale?
100%. I could say that, like I said it in the starting, like you guys have been like absolutely awesome. Like our relationship with the Zeeve, all the things that we required, like they were even when we were launching our mainnet, there were like so many problems. We had a deadline to approach, and there was just so much help that Zeeve provided us was like absolutely a breeze. There's always 100% uptime. There's absolutely no lapse in performance. And yeah, I mean, this mainnet couldn't be possible without you guys. I mean, I can just say that because I know like we were having problems and issues in deploying our mainnet, and you guys were able to help us on that. I don't look at the blockchain part that much because I'm totally involved in the large language side, but I could definitely see our Slack going completely crazy with all the problems and the issues that we were facing. And yeah, thank you so much, guys. Like, because of you, we were able to get our mainnet up and running on the time.
No, thank you. Thanks, Abhimanyu, for the kind words. I think it's quite motivating. And I'm sure our team will be very excited to hear this. And will they continue to strive to help you scale? Because as you scale your business, as you get more users, more transactions, definitely a highly scalable infrastructure is something which makes it possible. So we are going to be there every step of the journey that you take. And thanks for the trust you have in us.
Absolutely so much, Dr. Ravi. And just to make an announcement, we have like some very important partnerships to announce. So what Dr. Ravi is saying, the high traffic requirements and everything, these are going to come in next few months because we have been talking to a few companies that I cannot disclose much at the moment, but we are definitely going to be there where we would require that high throughput of the Zeeve, and we would really stress your servers to the maximum. Yeah.
Absolutely, we are looking forward to it. So now we are almost at the end of the AMA. You have already mentioned about some of the features which are right now there, and some of the features you are launching soon. Just a bit about the ULA token. How does it strengthen the ecosystem, beyond standard
Oh, yeah, absolutely. The ULA system token is like a part of the ecosystem. What we do with the ULA is like we are trying to build an Asiatic matching engine that is in the production pipeline at the moment. And what it does is, if you're a research company so one of the biggest problems that we also understand after talking to people was the medical research is very limited at the moment because medical data is not there yet. So if you want to do a research about a rare cancer, and you could have doctors sitting in United States who are doing this research, whereas someone from Malawi would be having this cancer, how do you bridge those things together? So we are building an Asiatic system that is able to match these two people, and the matching, the transaction, and everything. It's all powered by ULA. So ULA becomes like a absolutely central of Ulalo network, and we also want to use that for running smart contracts and Ulalo system, so that would act as a gas as well. But the main thing is like the Asiatic, the exchange of information happens, and that transaction is paid with the ULA token. So that is one of the main highlights of ULA at the moment.
Oh, that's very super interesting. I think having a solid token economics with a clear utility helps build the ecosystem, and so that all the actors, because healthcare is a big ecosystem. You have hospitals, you have researchers, you have patients, you have doctors. There are n number of actors, and I think right incentives and right utility will take the ecosystem, make it bigger and bigger. So, Abhimanyu, I think this has been a fascinating conversation, and I believe Ulalo is not just building a product. It's challenging how healthcare data is owned or shared or trusted globally. And I think you're also touching upon data monetization, which frankly, before this AMA, I was not very clear. And this is going to open up big time where I, as a user, own my personal health information, and I would be able to monetize it in my own way. So it's super, super interesting. And for everyone listening, I think go check out ulalo.xyz. They have a very solid app, both on iOS as well as Google Store. Download, use it, and do follow their Twitter and LinkedIn for more information. Keep updated with Ulalo, and do follow Abhimanyu. So thanks, Abhimanyu. Thanks for joining us. Any points you would like to mention?
Just that, Dr. Ravi, it's been a pleasure talking to you today, discussing all the details. Zeeve has been such a breeze of a partner. Like, I cannot thank you guys enough. Thank you so much for arranging this AMA. And yeah, I would be looking forward to all the questions from anyone. Feel free to reach out to me on my X or on our Telegram channel, and you can address me directly. It would be great if you guys can download Ulalo application and give it a go, and write us what your experience have been so far with it. And yeah, looking forward to hearing from you all. Thank you.
Thank you. Thanks, Abhimanyu. Thanks, everyone, for listening. And with that, we end this AMA. Thank you for joining us today. Keep building, keep smiling.
Thank you. Bye bye.